saw a patient today who was filled with regret. When he was diagnosed with diabetes and was given medication, the sugar became very good, and he decided that he no longer needs doctor since his blood sugar is good, and he usually checks his sugar level every week and it's always good. But what he failed to understand is that just because you are checking your blood sugar every week doesn't mean your sugar is good. You need to do glycated hemoglobin or HbA1c, and if you have the resources, you can buy continuous glucose monitoring, a device that you put on your hand and it gives you recording of your blood sugar over 24 hours. So that one will give you the real picture of your blood sugar. Apart from that, every diabetic patient need to do general checkup or screening for complication every 6 to 12 months. If you fail to do that, there may be complications that are going on in your body, but you are not aware of it. It requires the doctor, it requires you going to the hospital and seeing the specialist who give you all these tests that will screen for complication. One of these tests that you need to do as a diabetic patient is that you need to check your urine and see if there is protein inside. If there is protein, that means your kidney is leaking protein. It is the first sign of kidney damage, the first sign that diabetes has damaged your kidney. Apart from that, do a blood test to check your kidney function, if your kidney is able to sieve away substances that may be dangerous. Apart from that, you need to check your cholesterol. If your cholesterol is bad, you know that already you are at risk of heart attack and stroke, so you need to check that. Apart from that, you check uric acid, especially for people that have tingling and burning sensation on the hands and feet. It may be because of your uric acid. And also those who have joint pain, who have some abdominal pain, it could be because you have fat in your liver. We call it fatty liver, which the doctor will also take care of it. And other tests that you need to do to screen for complication. That's why it's important as an individual, you need your doctor, so that if you have any question, any clarification, you call on your doctor. Please, if you are diabetic, just because your sugar has been good and you have not been going to the hospital, that's wrong. You need to go for general checkup. Some of you made the mistake of just going to the lab and do anyhow general checkup. That's wrong. There's certain general checkup that is specific for diabetic patient, hypertensive patient, and the rest. So please have time and get yourself checked.